And Dr. Cole is going to continue explaining about the ICU staffing.
Okay, and so the other thing that's really important to note here is that for the assignment, the ICU nurse is monitoring and managing the hemodynamic monitoring, the vent, and the drips. Then I wanted to expand and just tell you when it gets all crazy and we are to critical standards of care. Okay, this is something that is really launched by a directive from the governor. We're not quite there yet, but this is important to know and to be planning for. So you basically extend what this looks like, and you couple an advanced practice nurse with an ICU nurse that then oversees the step-down nurses caring for 3 patients apiece. Same kind of rules apply. They're assessing the patients with the nurses. They're dividing and conquering. They're there to help them with any parameters or triggers that they've set that need to be alerted. They oversee conversation with the physician. And I think the neat thing about this is the best of both worlds, because you are doing basically training at the same time, explaining what you're doing and why. Now also in this is kind of a takeoff from the Society of Critical Care Medicine, critical staffing. This can also include the use of, when I say advanced practice, I'm talking about non-critical care nurse practitioners. In our unit, we have critical care nurse practitioners and intensivists. However, as their resources become thinner, then we add in those who, just like our step-down nurses, we add in CRNAs, anesthesiologists, who can manage the drips and manage the vents under the direction of the intensivist. We also will bring in our respiratory therapists who are absolutely managing our vents. We can also bring in teams to do proning. There's all kinds of resources. You just have to really expand what it is that you believe you're going to need.
Which type of team would you develop for proning? What would those members look like?
So you could actually, there's several suggestions out there, but one of the ones I thought was excellent is if we've kind of gone beyond our resources, especially outside of the ICU, where we're proning on our COVID units that are non-critical care, getting a team of OR scrub techs who are used to turning patients on the OR tables, utilizing a respiratory therapist and the physician as the team leaders. There's all kinds. You can use physical therapists and occupational therapists to direct to do proning.